Hello everyone, we are from Group 12 with the following members: Anastasia Eva Jumandi Sialagan, Melinda Sasmita Rambuata Mehan, Minerva Esterina, and Thessalonica Triposalam Putari. And we are going to talk about sildenafil. Here's our objective. For the first, to understand the mechanism of action of the drug sildenafil, and then to explain the indication for the use of sildenafil, and the third, to recognize the recommended dosage for the taking sildenafil, and the last, to know the safety and effectiveness of using sildenafil as therapy or treatment of erectile dysfunction. Introduction. Sildenafil or sildenafil citrate is a drug commonly used for the oral treatment of erectile dysfunction and has been shown to be effective. The safety of using sildenafil for erectile dysfunction treatment has been evaluated for more than 3,700 patients. Sildenafil works by inhibiting the phosphodiesterase type 5 or PDA5 enzyme, which is involved in the breakdown of CGMP and is responsible for the retraction of smooth muscle in the penile artery, resulting in slower breakdown of CGMP and increased blood flow to the penis, resulting in better erection. Erectile dysfunction is the inability of a man to achieve an erection or maintain a sufficient penile erection, resulting in unsatisfactory sexual performance. The number of men with erectile dysfunction worldwide is estimated to be up to 150 million. Organic erectile dysfunction can be caused by past phylogenic problems, impaired arterial inflow to the penis, or impaired venous outflow from the penis. Erectile dysfunction can have a detrimental effect on the patient's quality of life, such as the aspect of interpersonal relationship, and can even lead to depression.
The generic name of sildenafil is sildenafil, and for the patent name are Viagra and Refatio. Sildenafil is available in the form of oral tablets in doses of 25 mg, 50 mg, and 100 mg. Dispersible tablets, which are a type of tablet that dissolves in the mouth without the need for water and swallowing it. Oral suspension, which is in liquid form to drink, and also injection in the treatment of pulmonary arterial hypertension. For classification, the first is therapeutic class. Sildenafil belongs to the therapeutic group known as phosphodiesterase type 5 or PDE5 inhibitors. For primary indication, used to treat erectile dysfunction in adult men. For additional indication, also used to treat pulmonary arterial hypertension in adults. For mechanism of action, sildenafil works by inhibiting the enzyme PDE5, increasing level of CGMP in smooth muscle cells of the penile blood vessels, thereby enhancing blood flow to the penis during sexual stimulation. For the brand name, Viagra is one of the trade names for sildenafil. And for the pharmacological classification, sildenafil is classified as a drug that influences erectile dysfunction. These are the clinical use of sildenafil. The first is indication for use. Sildenafil is used for the treatment of erectile dysfunction, which is a condition where a man has difficulty achieving or maintaining an erection sufficient for satisfactory sexual activity. Sildenafil works by increasing the relaxing effect of nitric oxide or NO on the corpus cavernosum. For the recommended dosage is 25 to 100 mg with doctor's prescription and not consume it more than once a day. Sildenafil reaches its peak plasma level in 30 to 60 minutes and has a half-life of about 4 hours. For possible side effects, The most common side effects of sildenafil are headache, flushing on the face, and upset stomach. Less common side effects that may occur are temporary change in color vision, such as trouble telling in the difference between blue and green objects or having a blue color tint to them, and eyes being more sensitive to light or blurred vision.
So next is the pharmacokinetic. For the absorption, sildenafil is rapidly absorbed within maximum plasma concentration achieved within 30 until 120 minutes with a median of 60 minutes after oral administration in tested patients. The mean absolute bioavailability or the proportion of the dose that reaches the blood circulation after oral administration compared to intravenous administration that goes directly into the circulation observed for sildenafil is approximately 41% from a range of 25 until 63%. Absorption of sildenafil decreased when administered orally with food, with a delay in Tmax of about 60 minutes and Cmax of about 29%. For protein binding, sildenafil and its circulating N-desimethyl metabolite are estimated to be about 96% associated with plasma proteins. However, protein binding to sildenafil is independent of drug concentration. Route of elimination: following oral or intravenous administration, sildenafil is excreted as metabolites that are predominantly excreted in the feces, approximately 80% of unadministered oral dose, and to a lesser extent in the urine, approximately 13% of unadministered oral dose. Next is the metabolism. Sildenafil citrate, when taken orally, most will be eliminated through metabolism in the feces. Some is also excreted through the urine. 50% of the drug that reaches the liver will be metabolized before reaching the systemic circulation. Sildenafil is metabolized by the enzyme CYP3A4, which is part of the cytochrome P450 enzyme family. This enzyme is also responsible for converting the chemical structure of sildenafil into various metabolites, including the activity metabolite UK103320, which accounts for approximately 20% of the activity of the parent drug to PDA5, with a Tmax of 1.4 hours under fasting condition and delayed under the fed condition. N-desimethyl metabolites are also important and contribute significantly to the overall effect of the drug. N-desimethyl results from the demethylation process of sildenafil. This metabolite has selective activity against phosphodiesterase type 5 or PDA5 enzymes similar to parent sildenafil and has an in vitro potency in laboratory experience of approximately 50% of parent sildenafil. For the half-life, the observed terminal half-life for sildenafil is about 3 to 5 hours. For volume of distribution, the average steady state distribution volume of sildenafil is about 105 liters.
So for pharmacodynamic, drug action works by relaxing the muscle of the blood vessel and increasing blood flow to certain areas of the body. In addition, sildenafil also functions as a phosphodiesterase 5 or PDA5 inhibitor. Viagra, which contains sildenafil, also inhibits the PDA5 enzyme and helps lower blood pressure. The interaction: 1. Sildenafil is metabolized primarily by cytochrome P450 3A4 and inhibitors of the enzyme for example, with macrolide, antibiotics, antifunals, and cimetidine, may increase sildenafil serum concentration. COUs with alpha blockers such as terazosin, and tamsulosin may increase the risk of a drop in blood pressure and fainting. COUs with antihypertensive drugs such as amlodipine may cause blood pressure to decrease to below normal. Avoid PO administration with nitrate drugs as they increase the formation of CGMP. This may result in severe hypotension. So the contradiction of sildenafil is, are allergic to this medicine, are undergoing treatment with nitrate group drugs, such as nitroglycerin, have recently had a stroke or heart attack, have a severe cardiovascular disorder such as unstable angina or heart failure, have an IAOE or non-arteritic anterior ischemic optic neuropathy, which is causes vision loss in one eye, and have hypertension or low blood pressure with blood pressure less than 90 per 50 mmHg. So this is the protection of safety of use sildenafil. Important things to note to ensure safety in the use of sildenafil dark are is pay attention to the correct dosage and comply with the instruction for use given by relevant medical personnel to avoid the risk of increasing serious side effects. And then pay attention to the interaction of this drug with other drugs or with the physical condition and health of the patient. Sildenafil should be used cautiously in patients taking alpha blockers such as amlodipine due to the risk of causing hypotension symptoms if taken together. The use of sildenafil in patients taking organic nitrate in all forms is not allowed, as it is contraindicated. So this is the reference our book used for the sildenafil. Thank you.